am Asha Agarwal, speech pathologist and audiologist, Ganga Ram Hospital. 25th April is a DNA day, and Indian Speech and Hearing Association has joined hands at global level to create awareness about the importance and the role of genetics. We have with us, and we are honored to have Dr. Professor Ratna Puri. She is the Chairperson, Institute of Genetics, Ganga Ram Hospital, with more than 39 years of experience. She will throw some light and enlighten us about the importance of genetics, early identification and its role management. Ma'am, please.
Thank you so much, Dr. Agarwal, and I'm really privileged to be a part of this DNA Day with your association. So if we come to hearing loss it's not so rare, and therefore world over, and even in many centers in India, including Ganga Ram Hospital, we have newborn screening for hearing to assess if the baby who's born has any hearing loss. Because if we pick up hearing loss early, the management is initiated early and the outcomes are good. Now, as far as the genetics goes, 50% of hearing loss is of genetic origin. It could be an isolated hearing loss where, other than involvement of hearing, there is nothing else and the child is developmentally normal. Of course, if it's early, it is prelingual deafness. That means the child has not developed speech. Whilst there are some disorders which are called syndromic genetic disorders where there is other organ involvement, and hearing is one of them, and it may manifest early because that's, the child does not speak, and that what brings the child to attention. And in our center we've had cases like that as well, where as we followed them over many years, other organ systems were involved. So all these disorders can be picked up by doing a DNA-based test on a blood sample. It's very important, especially if there is a family history, and even if there is no family history, to do testing. The relevance of doing testing is when you make a confirmed diagnosis and the parents want to understand why their child or why the other member in the family has hearing loss. The other reason is that we can test other members in the family who are at risk for deafness. We understand that by the genetic test report. We can also prevent the recurrence in that family of another baby who's born with deafness by doing a test during pregnancy. And I think last but not the least, a lot of therapies are coming out with new technologies and new discoveries, and they are all DNA mutation based tests and therapies that become very, very relevant to know what the mutation is so that the treatment is for that specific gene change. So I think the message on this very special DNA test is do a good clinical evaluation, look for hearing loss, look for associated things like delay, other organ system involvements, autism, anything that could make it syndromic. And whether it is isolated or it is syndromic, it's important that we get a genetic test done and refer them to the clinical geneticist so that the care of the patient is wholesome.